Anxiety is not always about panic attacks. Sometimes anxiety can be subtle, okay, and many adults actually ignores because it is sometimes subtle and we cannot see it in the DSM-5 criteria. It's not meeting DSM-5 or ICD-11 criteria, so we just ignore it. But we actually need to put our eye onto that because that is really important, and it can take a severe toll if we really ignore those symptoms, right? So here I am going to share 5 symptoms which usually adults ignore. Firstly, constant overthinking. We constantly overthink about the situation which has happened in the past. We actually replay those situations again and again in our mind, and sometimes we actually think that what will happen in the future. We imagine the scenario that if she behaves in this way, if she or he behaves in this way, how I'm going to react, how I'm going to deal with it. Okay, we just imagine the worst case scenario, and we feel that if I get this attack or this, if I feel very anxious, I lose my calmness, then what happen? What will happen? Right? Secondly, irritable mood. Oftenly, that person may show irritability in small things, which he or she has not been showing before, but now the person has started showing those symptoms in his or her behavior. Okay. Thirdly, restlessness or inability to relax. That person may feel restlessness. Okay. Actually, we often try to control our mind and our body, and we all really want to feel relaxed and calm, but sometimes it becomes out of control, right? So that person may feel difficulty to relax his or her mind, or difficulty in relaxing his or her body, right? So may have tensed muscles, may have tensed mind, always chattering, and you don't feel calmness in yourself. So this can also be an anxiety. If you don't tackle it, it can take a major toll on it, right? Then procrastination or indecisiveness. We often try to make a to-do list with a lot of difficulty, right? And we fail to work on it, to act on it, and it's not happening 1 or 2 days, it's happening constantly. It's happening constantly because of the fear we have in our mind, the threat we have in our mind. There's some kind of fear which we have in a subconscious mind. That is a symptom of anxiety. Physical symptoms like breathlessness, chest pain, or heart palpitation, or sweat in our hands, okay, or nausea, vomiting, or sometimes we feel stomach pain or issues related to stomach, right? So these are some of the symptoms which we really ignore because it is like, it's a very subtle symptom. We don't give much attention to it, but if we look into it at an early stage, then we can actually help ourselves to stop getting any clinically diagnosed symptom of anxiety at a moderate or severe level, right? So if you feel any of the symptoms that is happening on a regular basis, constantly with you, and it's hampering your work life, your professional life, your personal life, then please do reach out to any of the professionals, psychologists, or a mental health expert, right? This is really important because mental health actually matters, right? Thank you and have a nice day.